So you may be thinking to yourself, how is your approach actually different? And I'm going to try to summarize this in a few different things. First is philosophically, I believe that a lot of healthcare and wellness care it has two distinct orientations, and depending on the orientation of the doctor and the patient will determine the outcome. The first orientation is what I consider a reactive orientation, where disease happens and we fix it. And where disease happens, we fix it. And we hope that by doing it that way, we can minimize the damage of the disease. The issue with that approach is it's always reactive. You're reacting to disease, you're not creating health. The other orientation is creative, where you've identified where you want to take your health, and now you're creating a solution that addresses not just symptoms, but also treats the cause. So my approach always is to ask the patient which orientation makes the most amount of sense to them, because depending on their orientation is going to determine the route that I take with them. I have patients that are reactive and I have patients that are creative. My goal obviously is to help patients get as creative as possible so we can treat not just symptoms but also causes. So how my approach is different is I start to look at what actually causes temporomandibular joint disease, not simply putting a night guard in and treating symptoms, but addressing the underlying causes that so many people often miss, whether it's a doctor, patient, whatever the case may be, it's just missed for whatever reason. So I take a step back, slow down and say what could actually be causing this problem for the patient, and then go in a goal setting mode with that patient to really not just eliminate symptoms, but create health for that individual patient. So in order for me to do that, I have to understand what the system is supposed to look like in health, how the muscles, teeth, joints, airway, the whole oral systemic structure, how it works in harmony. And then from there, I can figure out what may not be working for a particular patient and get them on a path to health. It's very similar to me as if you went to an auto mechanic and you had tires that were continually wearing out, or problems with the tires themselves, the tread wasn't, you're always wearing through the tread. If you went to an auto mechanic, maybe the first time they see the car, they would just replace the tires. But another auto mechanic might look at that and go, well, what is actually causing the tires to wear out prematurely? And usually it's the alignment. The alignment's wrong. Well, the teeth function the same way. You could be wearing your teeth out, they could be getting shorter, they could be breaking, you could have sensitivity, you could have bone and gum loss, you could have headaches, facial pain. And if we just simply replace the teeth like you would replace the tires, you're gonna continually have more problems. Whereas I look at that and go, well, what does the alignment look like? Are the joints, the muscles, and the teeth actually working together? And if they are, great. If they're not, how do we put this alignment back together so that this patient can have a long-lasting, functioning, healthy smile that lasts them a lifetime?